and I'm very excited about today's show. We are going to be announcing a brand new member benefit for you, your dependents, your staff, and your staff dependents. And this comes in effect as of January 1st of 2020. MSATP is now going to have a vision and dental plan opportunity for all of our members. So this morning I have multiple people joining me. So let me just go through the list. First, I want to welcome Mark. Pauline, Mark is here joining me here at the MSATP office. Online from Quest Insurance, I have Sammy Santora, Evelyn Waters, Jack Pintus, and of course, Mark, you're with Quest as well.
Yes.
Now, talking also with us is Michael Brashears. Is that right, Michael?
Brashears, yes.
Cheers,
Morning, everyone.
Brashears. And he is from Dominion National. So first of all, I want to thank all the team from Quest, from Dominion, and also the people from MSATP who has been working very diligently to get this program off the ground. I'll tell you, we have built a very affordable and comprehensive program that's going to be great for the members, for their dependents, and for their staff. So I'm really looking forward to kicking this off. So like I said, we have two different programs, a vision program and a dental program. So Michael's going to talk first about the vision program. Michael, thank you so much for joining us this morning. Can you give us a little bit about the vision program, what's included, the cost, and how members are going to be able to sign up for this great benefit?
Yeah, absolutely. Thank you, everyone, for joining today. I am Michael Brashears, the Vice President of Sales at Dominion National. And just real quick, I want to share my goal for this presentation, that we are really here to help introduce and educate these available benefits between the dental and the vision to help you make an educated decision and really help find a product that's going to make sense for your unique needs. So what we are going to do is we're going to start just a quick intro on Dominion, and then I will give a rundown of what is available through the Vision program. So if you're not familiar with Dominion, we are a regional company based out of Arlington, Virginia. I'm going to get into it in much greater detail, but we have 900,000 members, so an extremely rich member base with primarily the members located in the Mid-Atlantic as well. So what I'm going to do is walk you through briefly on the Vision plan that is available. What we have done is we have partnered with MSATP and the various members on this call to offer our 60/30 Vision plan. So the easiest way and most effective way to explain a vision policy is to focus in on the key features within the vision plan. Those key features are the frequencies, they are the co-pays, and they are also the allowances that are available. So there are 4 main services that are available through this program. 1 being the exam, 2 being the lenses, 3 frames, and 4 contact lenses. So to tie in the key features of the program between the copay, the frequency, and the allowance to the 4 main benefit features that are offered, I'm going to walk through each of them and explain the frequency and the copay/allowance for those available services. 1, the exam. Within this program, you'd be eligible for an exam every 12 months. With that exam, there is a $10 member copay associated with it. So essentially, you're eligible for an exam every 12 months for a flat cost of $10. 2 would be the lenses, similar to the exams. The lenses, you're also eligible for lenses every 12 months, and that is also going to have a $10 copay associated with it. Frames are slightly different. Again, you are eligible for frames every 12 months. The difference is there is no copay. You do have an allowance towards your frame. So every 12 months, you have a $120 allowance towards frames at a participating provider. The reason that I say participating provider is in addition to the $120, you also have access to an in-network discount. So those base prices that you're going to see if you're walking into a participating provider are going to be significantly lower than if you just walked in without any insurance program. If you are looking to go down a route and doing contact lenses instead of frames or lenses, that benefit works very similar to how the frames allowance works. So every 12 months, in lieu of traditional glasses, you would be eligible for contacts. And I say in lieu, it is one or the other. and every 12 months you would have $100 allowance towards contact lenses of your choosing. Does anyone have?
Michael, can you repeat that last, what you just said about the contact
Yeah.
lens? Repeat that last sentence again.
Correct. So in lieu of traditional glasses, so your traditional frames and lenses, you are eligible if you prefer to go down the contact route. In lieu of the traditional materials, you can get contact lenses once every 12 months. And the way that that benefit works is that you have a $100 allowance towards the in-network participating providers.
Gotcha. And that's annually, correct, Michael?
Yep, every 12 months.
Yep, thank you.
And that 12 months starts from the time of service.
Okay. Thank you.
Couple of things there. I think Michael can elaborate on. This program has been put together by Dominion with a phenomenal network of participating providers, so he can probably address that. What we did when we shopping for the different carriers, we found that Dominion has a fantastic footprint that meshes completely with the membership that MSATP has. So if you're a member, likelihood for you to find a provider that's in a network with Dominion is very, very high. Second, on all these benefits that Michael had described, most of these, as he will elaborate on those a minute from now, they're wholesale prices. In other words, the $120 he mentioned about the lenses or the $100 on the contacts, that typically translates into a little larger amount on the retail side. It's always beneficial to stay in the network, to find someone who's contracted with Dominion to reduce your cost and make sure they abide by their contract. But to the extent you decide you elect to go somewhere else, those are reimbursement that probably you'll see a very decent reimbursement amounts.
Very good point, Sammy. Thank you for sharing that.
Correct. And I can also chime in on that. That logic applies to both the vision and the dental, which we will be touching on, but it is very important. A provider being in network means that they have agreed to set prices that are generated from Dominion. So not only are you going to have a discount through the program, but you're also the baseline price of the service, whether it's the vision service or the dental service, is going to be significantly lower because there's the cost control with the relationship with Dominion. And yes, on the Vision Network, and thank you for bringing this up, we have over 60,000 access points nationwide. So it's available in all 50 states, including DC. And it also includes major retailers such as Walmart, Provision, Sears, JCPenney, Four Eyes, Our Eyes, and Target as well. So I know a lot of the members, me personally, once you start knocking out those major retailers, the access points really go through the roof. And those major retailers are in addition to the individual and smaller practices that are scattered throughout the country.
That's great. Yeah, actually, that was one of the notes that I noted on my presentation here, was the amazing opportunity with the 60,000 participating providers, which and nationwide, which is wonderful because we have members, who are all over the Mid-Atlantic coast. So it's just not a Maryland situation. We are actually passing our borders and allowing this across nationwide. So with that is wonderful. Thank you, Michael. Did we lose Michael?
So on the vision side, that is really the core of it. My intention of this was to walk through the various services that are available. So the exams, the frames, the lenses, the contacts, and then understanding what goes within those services. So understanding the frequency, which is 12 across the board, the copays, which is going to be $10 for the exam and the lenses, and then the allowances, which is going to be $120 off of that wholesale price, which I referred to on the frames, and then the $100 allowance every 12 months in lieu of the frames at that wholesale price of the contacts. So those $120 and those $100 are going to go a lot further than they would if you just walked into one of the retailers without an insurance program.
Right. And, Michael, what I found, actually, I was just at the eye doctor on, I believe it was Tuesday, and we have a plan in place. And one of the other things that I found, and just in comparison, is when I get my glasses, I get the tint. And I was, I know what I paid on Tuesday when I was at the eye doctor, and then I was reviewing the vision plan. And if I was using the Dominion vision plan, I would have saved $65 on that alone on my glasses. So it's just not
Wow.
the glasses and the frames. It's also the other extra things, the UV coating, the tinting, the scratch resistant. So it's a very, like I said, it's a very comprehensive program, which is wonderful because, again, all of us like to personalize some of our products, including our glasses, and so this plan gives you that opportunity.
Absolutely.
Great. So, well, thank you for that. Well, at this point in time, let's move on to the dental plan. And that,
Yeah.
again, I am very happy with the plan that we put together. And can you tell us all about that? Because I know, I mean, the vision plan is a big project. The dental plan is even a larger undertaking. So I know this is going to take you a little longer because it's a lot of moving parts. So please, Michael, the floor is yours.
It is. So it's not too complex, but it is more complex and more detailed, just the nuances of the dental compared to the vision. So what we are offering, and this was really important because everyone does have unique needs. So we're offering two core plans. We're offering a PPO policy and an HMO policy. These letters and acronyms should be familiar to you. They do line up with the terminology on the medical side, but I'll spend a minute just explaining the core features of a PPO in comparison to a DHMO, and then walk through a little bit more specifically as to how the benefit works, considering the services within the plan. So on the PPO side, what you have, one of the huge advantages is the access. So we have, and I'm going to dive into the network in much greater detail, but wanted to provide a snapshot. We have a national network on the PPO side with 300,000 access points nationwide. That 300,000 access points is an incredibly strong number. But a huge advantage is, in addition to having the in-network providers, you also have the ability to use the benefit on an out-of-network basis. We do always encourage, just like I touched on in the vision, to use an in-network participating provider, because going back to the fundamentals of being in-network, we do have the cost control parameters, because if they are in network, there is a limit to how much they can charge for all of the services that you would be looking for. But if there's a provider that happens to be out of network, you still have access, or the ability to access that provider if you are not looking to particularly change your provider. So the big fundamental of the PPO is the access, the in and out of network benefit. It's also a coinsurance based plan. So the way that the benefit works is you will get a coinsurance schedule that explains for each service the amount that Dominion will pay and the comparison to what the member will pay. The coinsurance schedule is different in and out of network, and we do have benefit summaries that should be available through the MSATP website. And then also there's a deductible that is included on this plan. The deductibles are incredibly low if you're comparing this, which you're probably more familiar with on the medical side, but there's a $50 in-network deductible and a $150 family deductible. So still incredibly low. And then there is an annual maximum on this program. So there is a $1,500 annual maximum. The $1,500 represents what Dominion will pay towards the benefit in that given year.
Michael, can I ask a question? Is the $1,500 maximum, is that per individual as well as family, or is the family more?
That's a great question. So it's per enrolled. So it'd be a $1,500 bucket of money for each enrollee. So if there's 3 on the plan, it'd be $1,500 for each individual that's on the program.
Okay.
I do want to walk through how the actual benefit works within the PPO, because what we do is we break up these services into 3 categories. One being the preventive and diagnostic, which we refer to as your class 1. In network, this is going to be covered in full. So it's 100% coinsurance, meaning that Dominion will be responsible for 100% of the claims dollars for your preventive work. Within that, your deductible is also waived. So it is truly, if you're going to an in-network provider, your preventive care is free of charge. Out of network, this is a 90% coinsurance, meaning that Dominion will cover 90% of the benefit, and the remaining 10% will be on the member. Please note that because, going back to, again, just really hammering it home, the in-network discounts, because if you are visiting an out-of-network provider, we do not have a relationship with that dentist, that there is the potential for bounce billing. Bounce billing means that we would base our 90% off of what we consider the in-network charge. So if our in-network discount for a cleaning is $100, and then that provider goes and charges $140 for the cleaning, in addition to the 90% coinsurance, that $40 difference between the in-network price and the out-of-network charge for that member, that additional $40 would be on the member. So it really is an incentive, just like all insurance programs, to stay in-network. Mm-hmm. The basic care is covered at 80%. So this is going to be your fillings, which includes silver and composite white fillings, will be covered at 80%, as well as some basic extractions. Out of network, similar to the class 1 services, the class 2, which again are going to be these fillings, are going to be covered at 70%. So there's a 10% difference between the co-insurances there. And then the major, this is your crowns, bridges, periodontics, endodontics. That will be covered at 50% in network and 40% out of network. Please note that there is a 6-month waiting period for the major services on the PPO plan. But if you do have prior coverage through a prior carrier, whether it happens to be Dominion or through an exchange or a spouse's policy, we can credit the time on that program as long as there's no break in coverage towards that 6-month waiting period.
Mm. Well, that's a really nice benefit.
Exactly. And what I would really say is that this benefit, and those on the call can agree, the 180/50 with the, when I say 180/50, the 180/50 coinsurance broken down by class, as well as the $1,500 annual max, compared to what is in the market, it is a very rich benefit that's available to members.
I can attest to that. And we see in this every day. On the individual side, it's very hard to procure dental coverage, period. So if the membership is not part of an employer group, it is very difficult at times to find an adequate plan that doesn't have lots of challenges and high costs. By the way, we did not mention the premium cost, how affordable it is. We're going to come to that in a second. Second, some of these platforms out there that's being advertised, lots of them, they don't have a robust network. So Dominion has, like Michael mentioned, more than 300,000 providers nationwide, particularly our footprint in the Mid-Atlantic. I think in Pennsylvania alone, they have 13,000 dentists. Delaware, which is a very, very difficult state, almost by the virtue of it being small, it's very difficult sometimes to find in-network dentists. They have about 200 or 300 dentists in there, 800 in a district, 4,500 in Virginia, 4,000 in Maryland. Very robust network. And why the network is important? Because by the virtue of being part of the network provider, you're saving almost 50% of the cost. And so therefore, your 180/50 will get you much, much further. And that $1,500 will provide you a lot more benefits. So just a point of reference, a couple of cleaning a year, which is part of the preventive care, typically will cost you about $700 if you don't have any coverage. The rate for the premium that we managed to procure for the MSATP for the PPO plan with this robust coverage is about $32.50 per month, which comes to about almost $350 a year. So by just that alone, you're in the black, if you wish, financially. For some of the members who are very much accountant driven, that you're in the money. You're making money. Anything extra would be gravy. So one of the things that we try to do here, as we looked at different options, different plans for the members, find a win-win, a win for them to make sure that they save money and provide their employee and themselves with adequate coverage, but also bring those benefits and give them a platform that makes it easy for them, A, to enroll, B, to be part of a larger picture that can benefit both the association and the member. Um, Mike's going to address the HMO and a couple other things. I want to step in one more thing. All these benefits that we're describing right now, we made it so easy for you to actually enroll in these by just a click of a button, by creating a portal for you that we can introduce that very shortly, to make it easy for you, for your dependent and your employees to actually enroll, to see how the benefits work, to ask questions, to chat with us. The reason why I have all this stuff in here, Mark, with Sandy and Evelyn and Jack with me, is to make sure you know that we are here for you. So there are explanation, enrollment, termination issue, claim, advocacy, anything like that, we are here for you. In addition to the Dominion team, that's phenomenal. We had a wonderful experience with them over the years. So back to you, Michael, about the HMO and how wonderful that benefit would be for the members.
Michael, before you do that, do have a caller coming in and asking a question that if you could address. What are the
Yep.
qualifying rules on implants and waiting periods?
Yes. So unfortunately, the PPO does not cover implants. There is a 15% discount on the HMO, the DHMO on implants. As for the waiting periods, the only scenario that a waiting period would apply is there are no waiting periods ever on the DHMO. There will be a 6-month waiting period on the PPO just for major services. Again, that 6-month waiting period is extremely low compared to what you'll find out in the market. But again, we can credit time on a prior dental program as long as there's no break in coverage towards that 6-month waiting period.
Okay, thank you.
So what I will do now, because we are, I know, running a little bit tight here, just walk through the DHMO. So when I really emphasized access on the PPO, what you're getting on the DHMO side is an incredibly rich benefit. The way that this benefit works is it is an in-network only policy. Our network is a regional network, so all the way up from New Jersey down to Virginia, the Virginia Beach area, with an extremely strong concentration in the Baltimore, DC metro and Delaware area. The state of Delaware is actually has this program for their employees, the DHMO. The way that the benefit works is you do have to pick a participating primary care provider, just like you would on a medical HMO, and you follow a fee schedule. So you'll have access. A fee schedule will be sent to you. That fee schedule includes hundreds and hundreds of available services, as well as a copay amount next to it. The advantage is that copay is your exact out-of-pocket cost. So you have that cost predictability of you'll know exactly how much you'll be paying at the time of service for that given service with the participating provider. And it also is an unlimited benefit, which you're never going to find in the industry. So when I say unlimited, there's no deductible, there's no annual maximum. So it's an uncapped benefit and no waiting periods as well, which I alluded to at the top. To give you a comparison on the savings between the PPO and the DHMO, because it can be hard comparing a fee schedule to coinsurances, the Class 1 services are going to be covered at 100%. So the copay for those would be $0. The basic care is going to be covered between 85 and 70%. So a very rich benefit. And then one of the huge advantages and where this benefit really starts paying off is the major services. Mm-hmm. So those services are covered between 70% and about 55%. So as you can see, that is a jump up just from a benefit perspective from the PPO. There is a $10 office copay that's associated with it. But again, the $10 office copay is going to be extremely affordable and low compared to what else you will see in the market, especially after you're looking at those in-network discounts. And then from a network perspective, we have the largest open panel DHMO network in the Mid-Atlantic. HMO networks are typically much smaller than what you'll see on the PPO side, but we have over 6,000 participating providers within the Mid-Atlantic. And just a testament to how strong this DHMO program is, a few of the huge names in the industry, United Healthcare and Guardian, both resell this program to their members. And we also have several key clients, such as the federal government, that is using or has access to Dominion's DHMO, as well as the state of Delaware.
Yeah, what was very important, we learned a few years back, and the reason why we get really working with Dominion is some of the large carrier like Care First, for instance, in a very tough area like Delaware, they actually access Dominion to help their membership because of the tough time they have contracting directly with those providers. So Dominion did a wonderful job. I don't know how they did it, but they did it in convincing lots of dentists to compromise and be part of their platform. Um, a couple of minutes left, so I want to make sure that so this wonderful benefit that Mike just mentioned to you a second ago, the cost of that on a monthly basis is $17.61, which makes it about $211 a year. Think about it for just a second. Unlimited benefit, no deductible, everything covered. Some discounts on that implant. By the way, one of the things Dominion does very well, in the event that you have a major surgery or major work that needs to be done, you can actually submit to them a request and they can reprice that as a sort of an EOB to give you an idea what would be the out-of-pocket cost, which will give you an idea about how to negotiate and better negotiate with the dentist before the services are provided. So we think that for the price that you would pay, the benefits are phenomenal. Same thing on a PPO, $390 a year for a benefit that provides $1,500 worth of wonderful, excellent, very good penetration, good network. That's a good value for the money. The last one, or the first one we talked about, the Vision, $8.42 per month, $110 a year. That would, that would provide you with every 12 months instead of contact lenses, frame, and an eye exam. That's phenomenal. So with that said, again, the enrollment on these would be made very easy through a portal, but we want to encourage you. If you have questions, we're gonna post the benefit, and Sandy will have it easily accessible to you. My staff will be there. Jack has been doing a very good job in interacting with the membership. Mark will be taking the lead on the benefit as well. We're here. So ask us questions, interact with us, and let us make sure we serve your need for the dental and vision and hopefully some other benefits as well if you have questions. About anything dealing with risk management or risk transfer, would love to be your source of advocacy and sort of guide you if you have questions. Sandy, back to you.
Okay, great. Just some clarification on the pricing that Sammy just gave out. That was for a single subscriber. That was not a subscriber amounts for one dependence or two or more dependents. Of course, they were going to be a little higher, but what the pricing that Sammy just alluded to was just for the individual subscriber. So I just want to make that clarification and be totally transparent on that. Um,
Thank you. Thank you
so,
so
um,
much.
so the other thing is, so we're talking about these great benefits. So all these come effect, Michael, on January 1st of 2020. Is that correct?
That is correct. And it is important that we follow first of the month following rule. So what that means is the date that you enroll, your effective date will be the first of the month following that date. So if you enroll December 15th, your effective date would be 1/1. If you wait until after the year, and it is a rolling enrollment, although we do encourage to enroll as quickly as possible. If you enroll January 3rd, you would have a 2/1 effective date.
Right. So it's my understanding, Michael, that we're going to be doing this online. So we're going to do have a portal. Is that correct? In as well as Jack will be attending many of our upcoming seminars, and so he'll be able to assist everyone when they're attending the 1040 seminars coming up in all the locations. But if you're not attending, or you're attending in January and you want to get signed up now, so it becomes effective as of January 1st. Are we going to have a portal, Michael, to get this started?
Yeah,
Yeah,
let me
Sam, do you want to touch on that?
go ahead. Go ahead, Michael.
I was asking if you wanted to touch on it.
Yeah, so that's exactly right. So the portal is actually being constructed as we speak. We've been tested, so we'll have that launch date as soon as you give us the green light, Sandy. Um, no, a little footnote in there is in addition to the dental and vision, we also have another benefit coming up very very soon, and we're trying to make sure all these benefits are launched together for the benefit for the sake of time and accuracy. So hopefully within the next few days, you will receive an email and an announcement giving you where the portal is. But don't let that be a hindrance for being enrolled. So in the event that this interests you, we also have some other means of enrolling you, getting the documentation to us and interacting either with Jack, Mark, or Evelyn and we'll make sure that you're enrolled for an effective date of January 1st. But yes, the website has been constructed. We're testing it. We upload on these benefits. It's being synced with the Dominion platforms. And hopefully within due course and shortly here, we'll have another benefit will be added to that platform and launching all three of them together.
Sammy, if they want to call and get this started right now, or Michael, what number should they be calling to get started?
They will call us here and they will talk to a member of the benefit. They've all been trained to actually take the information. And we have a very simple application. They'll take it online or offline and take care of that member very quickly.
Okay, what is the phone number? We need that phone number.
That phone number is 703-961-8886. And you'll be asking for Jack, Evelyn, or Mark.
Okay. Can you repeat that phone number one more time, just so we have it?
703-961-8886.
Wonderful.
Is the phone number.
Thank you, Sammy. Now, as Sammy has alluded to, we have many, many benefits that we're working with Quest. The risk management, the general liability, the cybersecurity. Now we're going to be doing the dental as well as the vision. And now we're also, as Sammy alluded to, we're now talking also about long-term care as well as life insurance. And so we're actually trying to put that one to bed as well. Yeah. So we're working very diligently with that. And so we're having another meeting on that tomorrow afternoon. And so hopefully we can get that to bed, and we'll have a very comprehensive, affordable package that's across the board. I think that's going to be wonderful. And Mark, do you have anything that you want to share?
I just would just like to reiterate, Sammy mentioned a couple of times that the important thing to remember about Quest is that we really do advocate for our clients. There's a lot of mistakes that happen out in the healthcare industry. A lot of claims are, miscoded, misprocessed. And if the customer service department isn't getting you the answers you need, you want to reach out to us and we'll go to bat for you. We can't get claims covered that aren't part of the plan. However, if there are mistakes made, we can help you get them corrected.
Right. And like I said, hopefully we'll have this last part of the long-term care and the life insurance finalized, and we'll have that on board before Thanksgiving. I want to thank all you guys for joining me this morning. And I'm telling you, as the person who is looking at retirement in a few months, I'll definitely be looking at this, because I tell you, it is very affordable, and it's a very, very comprehensive and affordable program. So I really want to thank everybody for doing that. And so with that, I just want to say a couple of things that are concerning the Tax Preparer Board. I went to their meeting on Monday. The board has decided to continue to use the PSI exam, even though because they have not renewed their contract or have not awarded the contract, they are extending their current contract with PSI until May 31st of 2020. So if you're deciding to take the registered exam for the state of Maryland, the PSI will be the current provider for that exam. Also, the board is really expanding their footprint in social media. And so not only with the practitioners, but as well as with the consumers. So definitely keep a look out for that as well. So in closing, I just want to thank everyone for joining me this morning. And I want to wish you and everyone online, as well as everybody that's joining us from home, a very happy and healthy Thanksgiving. Enjoy your time with the family, and please don't eat too much turkey. We all overeat, don't we?
You're looking at the right guy.
I know, right there. I was from the beginning. I'm telling you. So with that, because of Thanksgiving next week, we will not have a show, because we'll be again enjoying our lovely turkey dinners. And so I'll see you in 2 weeks. And for thank you again for everyone for joining me, and have a wonderful day.